Hi, everybody. My name is Ron Robertson. I'm the co-founder and CEO of Picmonic, and I am joined today for the Mastering Medicine webinar series by our honorary guest, Dr. Marc Katz.
Thank
Mark,
you
how
for
you
having
doing?
me. Good.
Absolutely. Glad you could join. Dr. Marc Katz, currently based out of you're in residency at Drexel for internal medicine,
Yes, sir.
and did undergrad at Ross, and then you went to or did undergrad at Bring
Binghamton, yeah, upstate New York.
and then med school at Ross. And what year in internal med are you?
Second year internal medicine right now, so nearing the beginning of third year.
That's fantastic. That's fantastic. Well, so the point of this webinar series is we have a lot of users around the country who ultimately, just like you and I at one point in time, they have a lot of questions about medical school and the journey, right? From first year to second year, third year, fourth year, how do you get into residency? And so the purpose of this is for successful students like yourself who are further along in the journey to actually pay it forward or pay it back to the next generation of students. So sharing tips and tricks about how you survived this difficult journey of medical school. And so what I want to do is give us an opportunity over the next 30 45 minutes to jump in and break down that 4-year journey, talk about it, and we'll do it kind of in a sequential step from first year to second year to third year to fourth year. Sound good?
Cool, works for me.
Excellent. All right, so let's go ahead and just talk about first year. Even just based on the poll we just ran, it looks like there are a lot of first year students on here. So let's spend a minute and talk about getting your footing in med school.
I mean, there are a lot of challenges in med school, and I think there was a running joke at my undergrad institution. There was a comic that said, what do you call someone who graduates at the bottom of their class in med school? And the answer on the comic was doctor.
Yeah.
And it led me to believe that the hard part was getting in. And frankly, whoever says that med school is easy is full of it, because it's tough. Every single year is hard. When you're in med school, you look back at undergrad and you go like, I thought I was working hard in undergrad, but and even in residency now, I look back at med school and I'm like, I was working hard back then, but it's even worse now. So, or it's even harder. So there's a lot of different aspects, and I feel like the tools and skills of getting your footing in med school just continues. It's a different challenge, but it's similar when it comes to residency, and being able to master that is kind of a life skill. But for me, at the end of the day, the first part was how do I study? Because in undergrad, I wasn't in class for 4 hours a day, and then I go home and take 4 hours of notes, and then later that night review those notes, and then do it again 5 days a week.
Right.
So I think the toughest part in med school, which I struggled with the most, was keeping up.
Yeah.
It's just a complete different strategy of how you study, because it's also a different mentality of in undergrad where I might just memorize and then purge. Like after the final, you're like, oh, don't need that information anymore. That you can't do that. You can't afford to learn something multiple times, because at the end of the day, you need to learn it, and not just remember it, but understand it, because those concepts build on everything. What you learn in first semester, you have to build on second, third, fourth, and in towards clinicals.
The information compounds on itself. It really does. And it's one of those that if you can't remember something you learned first semester, you're going to get in trouble second semester, third semester, fourth semester, and let's call them semesters generically. But really, when it comes time for boards in step one, right? I mean, you're being tested on every single thing that you potentially learned in the first couple of years of med school. So, go ahead.
I mean, that was the toughest part for me. Was I remember we had kind of a test or a quiz like the first week or the first month of med school, because they know that a lot of med students don't know how to study as they need to just yet. And I remember just passing. I passed by like 1 or 2 points, and I freaked out because I didn't know, again, how to study and how to get those skills down. But I think for me, that was the hardest part, was just adjusting to having to remember it and memorize it for long-term retention.
And I faced the same problems. For me, it was, college. I was able to learn very, very quickly, pre-test, do fine on the test, and then forget it. But when we're talking about knowledge retention to become competent healthcare providers, this isn't information that we can just go and brush off. So let's talk about ultimately, there's a lot of information and now you need to retain it. So going into first year of medical school, that's a big change from what most students are used to. So what are some of the things that you did differently to adjust to that information retention? Was it how you approached the lectures and prepping beforehand? Was it what you did after a lecture? Was it, were there tools or resources that you used?
Yeah. It was a trial and error for me, because I used to take really extensive notes, but then I found that by the time I was done with the notes, I was too tired to go over them.
Yeah.
So then eventually what I perfected was the style of notes that I took, that I would take the notes in a format that would allow me to not have to do a multi-step process. What I mean by that is taking notes in the class and then turning those notes into a study tool. That my notes were a study tool. So I would just do half of a page would be a question, so I could cover it up. And then the other side would be an explanation. So I would have to actively study. And that was probably the biggest factor, is just actively studying, not just writing it down and memorizing it, but for me, what works the best was regurgitating that information again, writing it out on a whiteboard, and not wasting my time trying to be perfect, because I know I'm type A, and if I was drawing my anatomy and I drew the coronary artery incorrectly, I would want to redo my whole page. So getting past that, being a little bit more efficient, and also just figuring out what works for you. I couldn't go to class because I couldn't pay attention, because every med school, I went to a Caribbean med school, and I've spoken with many people I rotated with who went to Columbia, other American medical graduates who had the same issue, that there's that one professor who teaches biochemistry, and it's like they've never seen the light of day, because they teach us, they understand it quite well, but they can't reiterate it to someone who sees it as foreign, or seeing it for the first time. Yeah. So finding those resources like Pathoma, taking first aid and using it right from the beginning. Maybe not annotating it until I was in my second year, because I look back on my notes and I write down like what necrosis was, and then when you're a third, fourth year semester studying step one, you don't need to write down what that was. So really just getting the process down, and then using the right tools, whether it's Picmonic, I started using quite early, Pathoma, first aid, and using the resources repeatedly, trusting in it. The more you use first aid, the more you realize how valuable it is. Likewise with Picmonic, I started using it when I was in my bugs and drugs section, where it was back microbiology, and we were learning all these different drugs, and I could barely pronounce half of them, let alone remember their mechanism of action, adverse effect, all those things. So I think if you dedicate some time to your resources and use them consistently, it really pays its dividends. And then last thing was practice questions. Practice questions, not just to do them, but to find your deficiencies and then go study them. And that's the biggest thing that I carried with me into my step studying, was studying, practicing, and applying my knowledge with practice questions, and then finding what areas I was weakest in, and then going back to study it. That's the game plan moving forward for step one, step two, and even into residency.
There were so many just golden tidbits that you just shared there, and some of them might have seemed like subtle, nuanced tips, but I want to try and break some of that apart real quick, just so we can hit it for the rest of the people. First off, some of the tools and resources that you used. Between Pathoma, between first aid, between Picmonic, ultimately each one of those kind of plays into the studying process in a little bit different of a light, but it sounds like you leveraged up all those resources early on from your first year. And I know, and I say that because I didn't buy first aid until my second year in med school. And so actually, and then I really didn't even start annotating it heavily till 6 months before. So I felt really behind the game. Another one is question banks. I didn't buy a question bank until my second year. of med school felt very, very far behind. So question banks, Picmonic, Pathoma, first aid, buying them early, practicing with them, using them, and trusting in them, that ultimately these are going to be powerful tools. That's kind of one thing that I really took away.
Yeah.
Another thing you said, and I think it's really interesting, is this idea that you practiced active recall, right? So it wasn't just about taking notes and then rewriting the notes or highlighting the notes over and over. This, because what we get into this mindset of, we can rewrite something or review it over and over, and we get this illusion of mastery where it's like we think we know it, but we really don't actually know it. So actually forcing yourself to fold over the paper, do flashcards, or do question banks, that process of active retrieval actually helps reconsolidate memory. So it's very, very powerful, but it's almost one of those that, again, didn't really have to do it in undergrad. So discovering that in med school, it sounds like that really helped you.
Yeah, I mean, just 100%. I mean, to me, one of the things that is evident in medical school and undergrad and in residency is that, as a comparison, it's obvious when someone is a great teacher and they're able to help you understand a concept. And that's a skill, it's a skill to be able to teach. And it's a skill that we don't really teach how to teach. And likewise, we kind of, at least in at Ross, they kind of actually had some seminars in to bring it back to med school and med students, is how to study, and that it's a skill that you have to develop just like anything else. If you want to get a better jump shot on the basketball court, you got to have a good system in place to in order to master that. And I think that studying is a skill that you have to work on and find what works for you. And some of those things are, for me, it was isolation, studying until I thought that I mastered it, or could attempt to meet up with a study group, and then go over it with each other and try to regurgitate it. And the best way that I found to be able to not just regurgitate it to myself was to teach it. And kind of that was part of my onus of why I became an anatomy teaching assistant, was because I knew that at the end of the day, sure, it looked good on my resume, but it also, you'd learn anatomy first year of med school. Some medical schools just do it first semester, and then you kind of don't really focus on that as much until you get back to it when you go onto your step exam.
Right.
So again, it's that active recall, actively keeping the knowledge fresh and retrievable, and just finding different ways to do that, whether it was through being a tutor for or a teaching assistant for the semesters before you, or finding resources like Doctors in Training, Picmonic, Pathoma, and whatnot.
That's great. That's great. Well, so let's talk about, ultimately everything that you start learning in your first year of med school really does build into the second year. And we all know that there's the looming beast of step one, after your second year of medical school. So let's talk about that, right? It is a very lofty test. It's a long exam, covers a lot of information. It's incredibly difficult, and it helps determine residency placement, and for the majority, a large portion of the rest of your life. So not to build up its weight, we already know how heavy of an exam it is. But let's talk about some of the things that you did in order to be successful. And I won't give the audience, I'm not gonna put you on the spot and ask your score, but Dr. Katz did significantly well on step one, beat his goal score, and ultimately got into a great residency in New York, or Philly at this point. So tell me though, as a second year student leading up to step one, what are some of the things that you did, either did well or didn't do well, that you wish you would have done differently?
I think at the end of the day, the biggest thing that you got to start with from day one in med school is that, unfortunately, whatever an attending tells you, I love the how attendings would in the hospital are like, oh, you don't, in order to be a good doctor, to get a good residency, don't worry about the multiple choice questions. You just need to care for your patients. Like, thank you. I know I need to be good on rounds and everything, but you're not going to look at me no matter how good my letters of rec are if I don't get past your filters. So, you know, certain residency programs just don't look at you if you have a score below 210, 215. You know, it's different for what residency, it's different for the location or how competitive the specialty is. So at the end of the day, I mean, every med student knows it, but the importance of step one can't be, mentioned too much. And the issue that some of my friends had in med school was that they would do great on our med school test. And at Ross University, when I was there at least, they still did, you know, A, B, and C. So you got like a GPA. I know a lot of med schools do pass fail. And it's just my biggest piece of advice from day one is don't get tripped up on doing well on your med school test. Sure, you should do well because maybe that will be predictive that you understand every topic. But you need to remember that at the end of the day, you don't want to just cram for the test, but you need to understand the concept so that you can ultimately do well in step one. Because that's how I approached the beginning of med school. Really, I guess the beginning of my second semester when I had my footing down.
Right.
Was everything is in anticipation of step one. So really preparing for it is day one of med school, is focusing long term on it. I think I went a little bit off topic.
It's okay. It's okay. I mean, ultimately, so when we talk about, right, because again, it's the information is building, it's compounding, even getting a conceptual understanding. You know, for me, I really needed the ability to create a mental framework for all that information, right? To differentiate all the little details. And for me, it was mental imagery that helped, creating these little visual memory anchors and creating stories that helped me then place the information in my mind in a way I wouldn't forget, that then I could build a conceptual understanding off of. But tell me, ultimately, how either did you incorporate Picmonic into your studies in preparation for step one, or is that a very similar thing that you use? And I want to differentiate the idea of memorization from conceptual understanding, because I think ultimately to build a conceptual understanding, you need to be able to memorize the core assets or the facts or key points of anything. But tell me about how your experience and perspective, because it could be completely different.
So, I mean, I think what was really interesting is that there was actually I forget what his name was, but the guy who has the world record for the longest run on Jeopardy, I think his name was Ron or something. Anyway, he wrote a book on how he remembered all these random facts. And I think that the concept was that if you want to memorize something, if someone gives you 3 random words that you have to remember, if you create a vivid image about it, that you will have a greater chance of remembering it long term. So I think that's what's beautiful about Picmonic, is that it does that so well. That being said, I couldn't jump into Picmonic until I kind of understood what was going on, because it's hard to memorize something if you don't understand it. So how I tried to approach step studying for both when I was in my first 4 semesters of med school, as well as when I eventually was solely studying for step one, was learn the material, study it, and then come back to the Picmonic card, or later on after I cemented a little bit of my knowledge, and then use that to memorize those more esoteric facts and really cement it. Then do some practice questions, and then go back and the same process. Try to learn it, use the Picmonic card to memorize it and a little bit better, test and apply that knowledge, and then go back, see if you need to understand it, and then see, do I understand it but I just can't remember it, or do I not really understand it that well, and see what resource would really be the best use of my time. But that being said, after I was done with my first 4 semesters, and Ross actually does an accelerated program. We do like the first 24 months in 18 months. So I had 2 months of dedicated step studying, and my routine every single day was wake up, go over some Picmonics, go over, read a few things that I struggled with the day before, do a full URL question set, eat lunch, relax, go over those questions, go over the Picmonics, go to the gym, eat, relax, go over the same stuff. So it's just the repetition and using a multi-pronged approach to understand and memorize whatever it is that you need to do.
No, that's great. That's great. And it's interesting, a lot of students I talk to, and I always find this intriguing, but a lot of students use Picmonic in the light you're talking about, which is they're going to learn a concept and then they're going to use the Picmonic to supplement it and really help memorize the details, right? But we also talk to students who use Picmonic before they've ever learned a topic. And they'll actually learn it to create kind of this, again, this mental scaffold where they could actually recite all the details of a topic without having any clue what it means.
Yeah.
But then they can actually go into a lecture and try and, you know, build off of that that conceptual understanding. So we actually see people on both sides of the spectrum, but that's interesting to hear that's how you used it. And so so Picmonic was a resource you used for step one. Did it help? Did you feel like it actually helped you come step?
Oh, 100%. I wouldn't have passed med school if it wasn't for Picmonic. I mean, I know that you guys are with Picmonic, but that's, I mean, the God's honest truth. I remember even on step 2 CS, I think I was telling you the story earlier that I wanted to test a patient for pertussis, and I couldn't remember for the life of me how to do that. Like now it's just like, oh yeah, send the PCR. But all I could remember was the Picmonic card and the border Jenga piece of it, and I was like, Bourdet-Genu auger, whatever, culture with Bourdet-Genu auger, and I threw that into step 2 CS. I mean, maybe that's not why I passed, but I still use it. Good. I still use it today. We had a morning report about someone with some random rash, and someone brought up like, oh, they were a farmer, and I was like, oh, maybe it's oh shoot, I'm blanking on what it was right now. Not Coxiella. Shoot. All right, now it looks bad that I can't remember it. But in the moment, I remembered it right off the head. I was just like, maybe it's that thing that I can't remember right off the top of my head.
We're gonna come back to it.
But I still use it in residency every once in a while. Like those images are still vivid with it in my head.
That's great. So I mean, I love to, and this obviously is not a self-promotion to Picmonic, but it's important to hear how, you know, for us and everyone else, how students actually use Picmonic successfully. What did you use as far as question banks? It's a question we get constantly is, did you use Kaplan? Did you use UWorld? Did you use RX? And how many total questions did you do? Ultimately, when you think about what is the formula to success for scoring a 240 plus from your perspective, what are the top 2 to 3 resources that you would prescribe?
Yeah, I mean, I've written extensively on my blog about this. I mean, UWorld. At the end of the day,
questions, lots of questions.
The question bank is. I mean, I wish UWorld would just write a book, because I ended up just like annotating all of UWorld into first aid. So first aid was my Bible. You know, that was the epicenter of my studying. For step 1, I actually used Doctors in Training. I really liked that it just gave me an organized schedule. It didn't work for me as much for step 2, but I really liked it for step 1. So I used first aid as my primary like notebook. Doctors in Training as kind of the overriding schedule and repetitive nature that allowed me to succeed. And then again, you got to do, there's no magic number, but you have to finish all of UWorld before you take step 1. If you don't, I think you're setting yourself up for failure, because you're not challenging yourself enough. Granted, UWorld is much harder, I think, than the real test. And sometimes the real test has really esoteric, stupid things that if I studied, you know, for 10 years, I would have never gotten this random question right regardless. But, you know, I think if I had to give you a strong answer, I would say I think I did about 3,500 questions total. That includes, I did a little bit of Kaplan when I was an anatomy TA in like my second semester of med school. So I burned through like a lot of the anatomy stuff. And I didn't get through all of the Kaplan. I think I got through maybe half of it. And then I switched to UWorld. And then I did UWorld all over again. I did all of the questions that I got wrong.
That's great.
And that's on top of the 5 practice tests that, you know, I would do over that time period. So I think 3,500 practice questions was my number that I got to.
Yeah, it sounds reasonable. I know students, you know, on average, it sounds like these days the 4,000 question mark, which is, it's a lot. It's a lot of questions. But I mean, ultimately, if you're cranking through them and you start, you know, earlier in your first year, if not, you know, definitely early in the second year. But is there anything that looking back you would have done differently?
With regards to step 1 studying?
Yeah, prepping for step 1. I mean, ultimately, you did very well on the test, so.
You know, I think my system was good. I liked the fact that I wasn't on a rotation.
Yep.
All I did for 2 months was study.
So
Uh,
8 week dedicated step time.
yeah.
Yeah.
Um, the only thing that I would have really changed was from the beginning. Maybe I wouldn't have used UWorld because I still think that's the gold standard, and that's I wouldn't start UWorld right first semester. I would still save that for when you're really cranking up into a higher gear
Right.
for step studying. But I would have maybe used Kaplan or some other question bank a little bit earlier,
Yeah.
first or second semester, to really show me because the value of the question banks isn't just testing your knowledge, but it shows you how the question makers of step one, step two are thinking, and how you should be thinking about these questions. So maybe I would have just used a formal question bank a little bit earlier in my studying.
That makes sense. No, it's great. Um, well, you know, and this is kind of I mean, it might be a silly question, but even in some of the previous webinars we've done, this has been a topic. Did you actually feel like you were ready for step one? Because most people don't. It gets to a point where ultimately, you put in the time and you got to take the test. Did you push your test back at all, or was that kind of fixed date? And did you take it when you thought? Did you feel ready? Do you ever feel ready?
I mean, I say this to like the incoming interns. You're never ready for residency. You're just ready enough, and that goes the same thing with step one, step two. Um, for step one, I did not push my test date back. Um, I think my study plan worked quite well. Each one of my practice tests, I kept going up and up and up, and eventually I peaked um, on my actual step one. So I didn't move it back. I thought that the 8 weeks was really good. For step two, that was a different story. I had to push it back. I just I wasn't getting the scores that I needed,
Mm-hmm.
and I realized I was breaking my own rules where I would do all these practice tests, and I saw that I got 20 questions in the surgery. I was doing well in everything else, but I kept getting 20, 25 questions wrong in the surgery section, and I wasn't focusing on surgery. I just kept focusing on everything else, and then I was wondering why I wasn't doing well. Went
Yeah.
back and studied surgery, and it was easier to start picking up my score. So for step two, I had to push it back a couple weeks. But that's also because the studying for step two is a complete different challenge.
Yeah.
You're like in rotations. I remember I had 3 months of surgery and then a month of cardiology, and that was my like sub-I that I was trying to get a letter of recommendation. So it didn't leave, that 2 month period of I'm not doing anything
Right.
besides studying.
Dedicated step time doesn't really happen for step two. So let's talk about that. Let's go into third year and bridge that. So first 2 years of medical school, heavy book work. So you take step one, you might have a minute break, and then you're into clinicals and your third year of medicine. Tell me about third year, about rotations, and most importantly, I felt like the rotation or the shelf exams were very different than kind of the core knowledge exams in the first couple years, as well as you're out in the hospital or out in practice. What did you do to either shift how you studied or prepared, or the tools or resources you might have used then?
So I absolutely hated third year med school. I thought, you go into pediatrics, and I'm lost. I've never actually, treated children before, let alone, and I've got all this great knowledge about the mechanism of the medicine. And then the attending's like, so what do you want to give? And I'm just like, well, the mechanism of action is beta 2 agonist. And they're just like, all right, thank you, but what are we going to do? And then you
Right.
eventually master it. You get better. You know the routine. You know what to ask, what to do. And then they throw you off, and they're just like, all right, here, go to internal medicine now. And then you do that same routine. So it's a really challenging juggling act that you have to master a new specialty, and then move on and do it all over again. On top of the fact that, as you said, you're studying for this shelf exam, which my med school, and I think a lot of medical schools, because I've seen my med students on the wards, they're freaking out over this shelf
Right.
exam. And I really didn't like the shelf exams because, as you said, I thought they were a little bit different than what was on step one or on step two.
Yep.
Um, I think but at the end of the day, you should, just like in your first 2 years of med school, everything goes towards step one. Likewise, I think you should start UWorld early in third year and use that shelf exam as an opportunity to practice
Right.
that specific subset.
Great advice. Yeah.
You know, if you end with internal medicine or whatever your last block is, hopefully that will be a strong point in your study plan, and you'll be able to move forward and focus on the things that came earlier.
That's great. That's great. Tell me, just on that note, is there anything else that you felt was, again, looking back, it's always when we look back and I wish I would have known this or done this differently. Is there anything else that you would pay it forward as far as being successful in rotations? Thinking about interactions with either the people, the personnel, the accountability, the taking initiative. I know a lot of us are very shy going from, second year where it's all book work into the clinicals, and you're still at the bottom end of the totem pole, and you're surrounded by people who are all higher in the rank than you and know more than you, and we're all kind of timid. So what are some of those things that maybe you would pass on as far as
nuggets of knowledge? At the end of the day, you're paying to be there. That always stuck with me, and that's why when I'm with my med students, I try to teach them a little bit, because as a medical student, I mean, as a resident, I'm not paid much, but I'm paid to be in the hospital and be there. You're paying to be there. Get the most of your money. It's really difficult, and it's easier said than done, but the more experience you have, the more patients you see, the better you'll get. That carries true with residency. So I think the biggest things that in clinical practice in third year, what I wish I was a little bit better at was taking the initiative to see more patients, to practice those routines, to get more knowledge and more experience under your belt. And just, in the hospital, if you want to stand out, just be present. We're not attendings and residents and fellows know when you don't want to be there. I know when it's the fourth year of med school and you're going into urology or orthopedics, or neurosurge, and you're doing a sub-I in internal medicine and you just want to get out of there. I always tell my med students, like, if you just work hard, be present, and do your work while you're there, I'm fine with that. So and what I mean by that is, if you are on any rotation, try to take something out of it. Even if you're going into pediatrics or OB-GYN, you can learn something about blood pressure management from internal medicine. If you're in internal medicine, there's always something to learn. And at the end of the day, you might actually be the only person who's a doctor, regardless if you're a pediatrician. Someone might be having a heart attack in a random restaurant. So it eventually does come back to real life. So just try to learn something.
That's great. That's great. So let's say we've managed to get into medical school. We survived first year. We passed step one, and hopefully excelled. We get into third year. We're cranking through clinicals, and now into fourth year, right? So now it's really this transition in the next step of the journey and prepping for residency, and hopefully getting into a competitive residency. Tell me about what can students do to set themselves up for success in the residency and application process?
Fourth year is just, in every level of training, it just gets harder and harder. Except for fourth year. Fourth year is this magical time period where you matched. Like that time after you match, but you're still in the hospital is such a nice little treat. But in order to get to that point, at the end of the day, no matter what an attending or an advisor says, you need to, what we've been talking about, crush step one, crush step two. You need to, in order to stand out on paper, and that is to just get you your foot in the door, to get you past the filters of certain residency programs.
Right.
What will set you apart are really your letters of recommendation. When someone can vouch for you and say, this person is going to be a great intern, I would take them in my program. And I think that ties back into how to do well on clinicals. Be interested, show your interests. be excited to be there. It's so refreshing when you have a med student who's like excited to see the patient. And even if it's something that I like roll my eyes at, I'm like, oh, another asthma exacerbation, no big deal. But they're like so excited that they diagnosed it. It's refreshing to see. So getting those strong letters of recommendation really can set you apart.
Okay.
Your personal statements, just stay par. Don't try to get a hole in one. You do not need to be, just make your point and just don't let it hurt you. Because I've seen some personal statements that I like read and I'm cringing. I'm just like, do less.
Right.
So part of that is just don't shoot yourself in the foot. So crush your step exams, get good letters of recommendation. And the only other piece of your application is your CV or resume. So try to have some type of leadership role, whether it's a cardiology interest group or a few case reports that you publish with a resident or by yourself, or just being on a research project helps. And it won't guarantee you a residency spot. And it really depends if you're going for urology or neurosurge. The characteristics that they're going to be looking for are a lot different than if you're going through into pediatrics, psych, internal medicine. So you really have to be honest with what is expected of you, and then also just be honest with your application. If you have a 205 on step 1, it's not being mean, but it's just acknowledging your shortcomings, and you're going to have to compensate on step 2, or maybe if you don't do well on step 1 and step 2. Maybe mention that in your personal statement. So I think a part of this is also just being honest with your own strengths and weaknesses, and trying to just have a well-rounded application. And that brings me back to my last point, is just be a person outside of the hospital. I know that's really easy to say, and that's my favorite, attending aphorism is, just know all your patients, read Harrison's, do all the study questions, ace your tests, and then also, be a person and have hobbies, but don't get lost in medicine. I really think that the hobbies section on your,
just went dark in here. I don't know.
Well, I still hear you, so I think you still got power.
I think so too, but I'm not 100% sure. We're gonna keep rolling in the dark.
Doing it live. The last piece is just that hobby section on your ERAS application.
It's back.
Let there be light. The hobby section on your application is really just an opportunity for you and the attending or whoever you're interviewing with to not talk about medicine. It's crazy when you see it's awesome when you can be on an interview and talk about the game. If you think LeBron's going to be able to get to the finals again. And it shows that person that you have interests outside of medicine, that you can actually tolerate having this person be in your residency program for 3 to 5 years.
Hobbies, interests, relationships, things that are real life and do really matter at the end of the day. So it's really, really solid advice. So I think, what I want to do is, because it's we're wrapping up closer to the hour, I want to take a few minutes and open it up to the audience. We have lots of people online from, it looks like, around the world, everything from first-year med students to fourth-year med students and grads and beyond. I want to give you guys an opportunity to jump into the widget on this. You can ask questions to Dr. Katz, myself, Picmonic, and we're going to field a couple of those right now. So somebody right now out of the gates is giving you some significant props for your successes thus far, and also asking about your blog. So let's give a silent plug to your blog and talk about that just for a quick second. Why did you start it? What are you doing with it? Where's it going? 30 seconds. Fast pitch.
Great question. At the end of the day, I truly believe that there's a lot of misinformation out there, especially in today's era. And that ties into the fact that you probably had patients, the amount of time that you have with a patient in an office visit is inversely proportional to the amount of education that you need to provide them. So I started my blog initially with the intent of ultimately using it as a tool to enhance my patients' understanding of their disease process and their health, so that eventually they can say, instead of, I saw on TV that I should stop taking this medicine because it might kill me, that, hey, I read this article from my doctor that said I shouldn't stop my medicine before I talk to you. So here I am asking about that. So I started it initially because I wanted to uncover the hidden curriculum of med school and residency, but I plan to continue to use it really for patient education and patient empowerment.
That's phenomenal. This is a great resource, and well done with that. To continue down the list, somebody is asking, so Greg, advice for summer between first and second year, hardcore studying, research, enjoying yourself. How do you approach between first year med school, second year med school within that limited time frame?
So I'll acknowledge I went to Ross University. That's a Caribbean med school. We had about 3 weeks off per semester, in between each semester. So we kind of just ran right through everything. So we didn't really have a full summer off. We just had, another break and then get back to the island and keep going. What I've seen is a lot of some of my friends who went to US stateside med schools, DO or MD, that they did have a little bit more time. A few of them went on really cool missions, medical missions around the world. So they kind of were able to do the two things that I really love. One is, be able to have a really unique experience in medicine, but the thing that I would push even more is go enjoy yourself, go travel. You're going to have all the time in the world to study more. But if you can afford it, both time-wise, financially, I would say enjoy yourself, relax, and get yourself refreshed, because at the end of the day, med school's a marathon. You can't sprint it, and you need to be able to come back to that next semester and hit it hard. Just like the first day of med school, they're just like, here, 4 hours of lecture, go.
Yeah.
It's right back at it. So I would say think about your long-term health, think about your mental health, and set yourself up for success, however that might be, however that might look to you. But I would always say enjoy yourself in a safe manner, and try to travel the world if you can.
I agree. It definitely felt like after your first year, you're already exhausted. But starting second year, it really is, again, the beginning of another very, very intense set of exams that all build up to step one, and you want to be refreshed going into second year. So whether you're studying, whether you're traveling, definitely find a way to enjoy it. So we do have definitely some international students online, and there's a question about because there's some stigma obviously around going to Caribbean med schools or things of that nature. You can acknowledge that. Did you feel like it, number one, set you behind it all, or number two, that you had to do things a little bit differently or score even higher on step one, step two, in order to have a competitive US-based residency?
The God's honest truth is that I've met great US MD and DO and IMG med students who are fantastic, and I've met really bad ones from also across the board. I don't think that intrinsically there's anything different from a US MD DO to an IMG, but unfortunately the system disagrees with that. They're just straight up certain residency programs that will just not look at you because you went to an IMG. It is what it is.
Mm-hmm.
That being said, there are still plenty of residency programs that are competitive, that are really strong programs, that look at IMGs, that love taking IMGs. I matched at a large university program in the Northeast, which is what I wanted. So the best advice that I could say is crush step one and do the same things. Get good letters of recommendation, crush step two. That was my goal. I tried to get 20 points above the average for internal medicine. I hit my goal, and that's what I would try to do, just so that if I tried to overcompensate a little bit. But overall, I wouldn't worry too much. There's still a lot of strong residency programs, but unfortunately, as an IMG, you are a little bit at a disadvantage from the get-go, and that's why it's so important that you have to do well.
Makes sense, and I think I would agree with you completely. I definitely have friends and buddies who went to IMG schools and DO schools, MD schools, and it really depends. But at the end of the day, we can't, can't minimize the importance of some of the standardized tests, and whether that's unfortunate or not, it is the nature of the system today. So anything that you can do to get ahead on those tests, but maintain some sanity along the way is critical.
Just study all the time, but also be a normal person.
Piece cake, piece cake. So Dr. Katz, I want to give you another minute to share any other piece of advice or tip or trick that you might be wanting to. Otherwise, I don't see any other questions popping up. I see a lot of props and thank yous for you taking time to join us today, and I absolutely agree. Is there any other last piece of advice or tidbit you want to share? Otherwise, I'll go into some closing quick remarks, and we'll let you. I know you're you're a busy man, have lots to do, so I don't want to keep you much longer than we need to.
I guess my closing remarks are, at the end of the day, this is everyone likes to focus on the step exams. Just realize that eventually when you get to residency, none of it matters. Not a single person in residency cares at all about what step scores you got. It makes no difference in the quality of doctor you are. Unfortunately, the reality is you need to do well. But on a more lighthearted note, just try to remember why you went into medicine in the first place. Sometimes that's the invigorating spirit that you need to hit the books a little bit harder, to remember why you want to do it, why you want to be a doctor in the first place. And sometimes that helped center me to get me back to the books when you're feeling a little bit burnt out. And at the end of the day, all the habits that you build as a med student carry with you to residency, fellowship, attendinghood. And I would just try to avoid the mentality of, I'll exercise when I get a residency. It'll be easier then. I'll have a relationship. I'll get a puppy. I mean, I really want to get a puppy. Anyway, but try to build the life skills now and enact them, because it's never going to get easier. You're never going to have more time. Make time for the things that you care about, and go save some lives.
I agree. The building in the habits and the disciplines early is hard, and we always think that we can kick that can down the road and take care of it later, but it's not easy to do. So, and I again just taking a quick peek at some of these last questions, but it looks like again more just thanks and props to Dr. Katz. So also wanted to give everybody a heads up. Number one, first and foremost, Dr. Katz, thank you so much for joining us, giving your time to share with the next generation of students. We truly appreciate it. On the flip side, thank you all for attending the webinar today and sharing this experience with us. To close this out, thank you all. We also, just as a quick aside, just to let everybody know, because I saw one other question being popped up here. We do just both webinars weekly where we're inviting people, successful students, doctors, and owners of different companies to join us for the Mastering Medicine webinar series, as well as we'll give just quick webinar demos to some you and your friends or colleagues if you have questions about how to use Picmonic, integrating it into your class and studies. So just the kind of shameless plug there to Picmonic. But again, Dr. Katz, thank you for taking time. Good luck in the rest of your journey. Thank you, everyone, for joining us today. Good luck in yours as well, and we will see you again soon. All right, goodbye.